I am back at the office for today. So I am so excited about today's presenter. It is the Dr. Sherry McAllister. Well, she's just absolutely amazing. Now she has been on the webinar series before, and I wish you can see her beautiful picture. I wanted you to see her beautiful face live and in person, but we were having some technical issues. But as you know, the show must go on. So in case you're not familiar with Dr. McAllister, she's been in practice since 1996. She graduated from Palmer West. She is the Executive Vice President of the Foundation for Chiropractic Progress. And let me just tell you, she and everybody over there, they are waves of change, and they are doing everything they can to promote chiropractic to the rest of the world. I don't mean just in this country, the rest of the world. I can't even begin. I could spend the whole hour talking about all the amazing things y'all are doing at the foundation, but I'm not, because I want to, but I'm not. I'm going to let Sherry tell y'all about her presentation today, share some information with you. And again, thank y'all so much for being here today. Sherry, take it away.
Christy, you're so amazing, and I'm so grateful to be with this group. One of the main reasons why the foundation loves to showcase our materials is that you are actually the rock star. You're the one that can take what I'm about to present and put it into your community as the expert. And as we go through today's presentation, Complete Health Includes Mind, Body, and Spirit, I want to make a very sincere thank you to ChiroHealthUSA. They are a corporate sponsor of the Foundation for Chiropractic Progress. They're the innovators, the motivators, the passionators. They're the people that really do make the earth shake when it comes to helping our profession be the very best it can be. So I greatly appreciate being on here with you today. Thank you for spending the time, because I think when you see what we have planned here, this is going to help you create that base of information, excitement, passion for what you do, and explicitly become that expert. So people come to you to start talking about, what does my health mean to me, and how can I improve it, enhance it, and showcase it with my family, my friends, and my colleagues. So let's get started. Number one, what are we here to do today? Pump up the progress with the Foundation for Chiropractic Progress. And we're going to cover a whole new campaign. Listen, COVID-19 hit us all hard. We're still going through the ramifications, and we're still feeling the major stress spots that our patients are feeling. I had to redo an entire campaign that was all about the Olympics in 3 months. And so I can tell you that 16 and 18-hour days, not a problem, got those covered. Like Christy with ChiroHealthUSA, she knows long days produce plentiful opportunities to ensure that our mission stays the same, promoting the benefits of chiropractic care. So I've had lots of chiropractors reach out to me and say, cannot thank you enough for shifting to enhance your health with chiropractic care through mind, body, spirit. And then I have the patients and the chiropractors that will reach out and say, you know what? We're going through a COVID pandemic. Can you please showcase that we're still in an epidemic, which means we have a paindemic? And so I'm constantly on the fence between enhance your health and we need to help those people who are chronically suffering in pain. So today we're going to be on that side of the fence that showcases the time is the best for us to make the national news on enhancing your health with chiropractic care. And what does that mean? How do we talk to our patients, and what are we talking to them about? If we join together as a force, and I mean a sincere force, everyone is a family member of the foundation, because as a united opportunity, we then spread the benefits of chiropractic care as fast and as furious as we can, and no one is going to doubt that we make an impact in people's well-being. And how we do that is a conjoined effort between us raising awareness for those suffering in pain and those that are trying to make the best of what they've got right now. COVID-19 came on out of nowhere. It's changed our lives, and most likely will change it for the rest of our lives on how we do things and how we think about things. Now more than ever, people are aware that their health is a vital, precious gift from their children to their grandparents. That's what we're trying to explore with chiropractic care. And today we're going to cover nutrition, stress management, hydration, posture, sleep, and the current mindset. Everything we're doing in this presentation is for you and about your patients. So let's buckle up and let's start with talking to our patients. Number one, we start with the basics. Nutrition. Yes, many of us don't want to go to the grocery store right now because we're not sure exactly where the COVID virus is being spread or even how it's being spread. Oftentimes you hear the false narrative about this, that, and the other thing. Well, let's just start with, we need our patients to understand that for true health, the nutrition comes from the rainbow. And that's the ability to start talking to them about how are they eating. Many of them might be doing the canned food thing and have for a while. Hopefully, we're starting to talk about the potential of how the body reacts to the most incredible moments that we're facing right now, and that's our GI tract. Our digestive system and how we're talking to our patients about the environment and the potential toxins out there, the pathogens that we all know about now that have now entered into our homes as a media moment and our lives through our friends, our families, and our communities. We're maintaining a strong, healthy digestive system is key for promoting nutrient absorption, supporting their general well-being, and overall, everything that they're about is going to be coming from the nutritional sources. So when they come into your office, start having those discussions about how are they feeling from a digestive moment. We're going to get more into that in just a few moments, but we're now going to start with what really matters. It's stress. So many of our friends and family are feeling the impact of stress and how we're going to manage that. So what I'd like to say is using your Instagram, your Facebook, your Twitter, and your LinkedIn, we want to get about information that's going to change the way they think of things. And as they begin to adopt chiropractic with their well-being, we're going to make an imprint in the future. So one of them is optimize your wellness with just proper breathing techniques, helping your patients breathe through stress. And then what are some of the common improper breathing causes that go with it? Now, listen, I just had a wonderful opportunity to really discuss breathing and the impact that has been caused by improperly fitting bras. And it went on national news. And it was such a hit that NBC picked it up and then World News picked it up. And it was really just talking about constrictions. Improper bras not only affect your posture, but it increases the inability for you to take a proper breath in if that band is too tight. So if you like to, I'm going to ask that as a friend on this particular webinar, go to my LinkedIn channel, Dr. Sherry McAllister, so that you can start pulling these articles and sharing them with your patients on your social media platforms, because together we do actually make a huge difference. And I'm going to share with you what that difference means a little bit further on. But let's be reminded that belly breathing is a big part. Most of us are shallow breathing when we get stressed. And one of the things about stress is, in fact, this. 69% of the polled people during COVID-19 right now say this is the most stressful time they've ever had in their careers. Imagine working from home with a toddler or an infant. Imagine working from home with 2, 3, or 4 other family members trying to do Zoom meetings. This is stressful, and it could be an oasis to walk into your office for chiropractic treatment. But I do need you to recognize that chiropractic is helping during these stressful moments. The number one major event that most people start thinking about is 9/11 or 2018, the Great Recession. And that's looking at the mental health of individuals. But really, this is a very big time for many people. 88% of the workers reported experiencing moderate to extreme stress over the last 4 to 6 weeks. That's important because as we start to recognize and speak to the patient, we actually need to know, where are they? And they're stressed out. So as we start to work through stress, we start with the basics and just trying to get the patients to recognize some of the exploratory opportunities they can do to help themselves. And one of them's hydration. We're in the middle of July. In some places, it's 110 degrees. And hydration is one way for them to stop, take a break during their day, enjoy the water. It sounds simple. It actually sounds kind of redundant. Like, who doesn't remember? Everyone doesn't remember. That water bottle sits in front of you, and we need to encourage them because, as we know, water helps to actually lubricate a lot of the processes that go on in the body. I'm talking to you as a physician, but you need to talk to them, patient to patient, about what it means to create a positive environment with their sensitive tissues, their muscles, their ligaments, all of those things that really matter in mobility. Getting rid of waste, urination, perspiration, and bowel movements. Listen, bowel movement sounds really no big deal until you start reading about the number one, in many cases with medication, causes of constipation. And if they're already being compromised by their medications, imagine if we don't talk to them about their hydration. So we need to remind them that proper cleansing of their body starts with just the use of simple water, especially when it comes to hot climates, physical activity, or they've been under the weather for any reason. And, the people that have tested positive, we need to ensure, if they're not currently realizing how important their body and all of the pieces that come from today's discussion, it's time, because if you don't know someone now, you will in the future that will have sustained an infection. And how do we keep them motivated to make a change, even with hydration? We're all in the boat together. So make it fun. Fruit infused water. We use these infographics to really help them think about their body functions. Example, what about green tea, mint, or lime infused water? Why? Digestion, congestion, and just fresh. The breathing of the mint is a beautiful thing. How about strawberries? Well, I will tell you for sure that women like to ensure that they have beautiful skin. Encourage them to add a little extra vitamin C, a few little antioxidants to their water. Cucumber, lime, or lemon, great ways to ensure that you're looking at bloating, maybe appetite control. A lot of us have been couch potatoes during COVID-19. We're not doing what we regularly do. I am guilty of not getting as much outdoor activity as I used to. And I think we can all use a little pat on the back and say, it's okay. Here's some ways that you can encourage your patients. Now, we just won the Healthcare Media Awards. It's the first time in the chiropractic profession that an award for social media has ever been given to the chiropractic profession. And we won because of our posture toolkits, because we're reaching out. Now, many of you on this call have heard me talk about posture before. And what I'm asking you to do is don't let up. Now, the time is more important than ever. We're being recognized on a media level for the outreach that we're doing. One of them that hit me really excitingly was Martha Stewart. And we talked about ways in which posture is declining in our youth, Generation Z. How are we reaching out to them? The other part of this is in these healthcare awards, you got to look at who the audience is. And just above us is Dr. Oz, and he's making an impact. The 3 years ago article that came out through the New York Times had an orthopedic surgeon, I'm not even going to mention his name, an orthopedic surgeon talking about posture. Brace yourself. I read it and thought, I'm sorry, I don't know very many orthopedic surgeons who are involved in the prevention of postural distortion. And that pushed the envelope for me, saying it's not an orthopedic surgeon who's an expert at posture, it's a chiropractor. because we do this every single day in our office. We talk about opportunities to embrace our postural distortion and that it is a journey. So talk to your patients about it on a regular basis. And we collaborate, and we want them to be stretching. We want them to recognize that social media comes with social media problems, selfie elbow, tech thumb, tech neck, all of these things that we really are all engaging in becomes a problem. When we start thinking about problems, we need to think about solutions. What problems out there right now? Sleep. In fact, it is being recognized as one of the major contributing factors to the decline in activities of daily living. So much so that 57% of people are starting to talk about pain disrupting their sleep. So when we look at numerous studies which talk about insufficient sleep, we're talking about conditions that are going to be increased because of proper sleep. Think about all the chemicals that are released during sleep. And when you don't get the proper REM sleep, the biochemistry changes. The oxytocin, the cortisol, the DHEA, the adrenaline, all of these things are impacted when your REM sleep starts to decline. And as we know, if your REM sleep is starting to decline, it has been shown through multiple studies. And if you look at the one particular study below, which is the source of sleep medicine at Harvard Medical School, shortened lifespan. Now, if you're not worried about one thing, it's another, but the science behind the overall arching problems that we have during a pandemic is we talked about sleep and we talked about stress. Well, guess what? 7 to 8 hours of sleep per day is what we're supposed to be getting. How many are actually getting it? It's a crucial factor for mental health. And in fact, when you don't get it, your REM sleep, your rapid eye movement starts to decline, and that's where the brain activities start to fall off. Now, in this particular slide, you're seeing Thrive Global. This is an article we did just recently where we took the opportunity to start talking about stress, start talking about sleep, and most importantly, talk about chiropractic care. Because as we deliver to audiences that have never been reached about the benefits of chiropractic care, we want to engage them and educate them on what that looks like. Again, Thrive Global, this particular article, you can just copy paste this right into your newsletter, put it right on your website, or start pumping it out in text messages. You know, patients that sign up, they want to hear from you. Find out what their sweet spot is and how you can connect with them, and then share these types of articles on sleep, because one of the key factors is when we look at the ability for patients to stay in that REM sleep, 45% of Americans say that their sleep has actually impacted their activities of daily living. How can we help them wind down? Well, this is an infographic that will help them start talking about blue light exposure and how to reduce it. What does that even mean? You're the doctor. As you're starting to palpate their suboccipitals and they're just laying there, start talking to them about how are you sleeping? What are some of the things that you're doing before sleep? What's your ritual? And help them help themselves. Sleep position matters. Stress levels matter. And then finding ways to decrease the risk factors for obesity, diabetes, high blood pressure, depression, and so many more. And if you make them aware, they're going to be in a great place. Because what you want to do is you want to offer them tips for overall health and well-being. Because we need to position ourselves as that doctor they want to come and talk to about how to optimize their own performance at work, at home, during their sports, during their sleep. That's why this particular press release was drafted. I bring this up not because it's just talking about sleep, but because you're welcome to, as a friend of the foundation, start utilizing paragraphs and information and statistics out of our press releases. That's how we educate the public. Educating ourselves is another thing. This is a study out of Spine. Every time I do a particular talk on well-being, I can't help but not bring this up, because when you look at this study, it's in Spine, 2017, author is Adams. It's a study that actually tells you where the consumer is. When you can reflect on where your audience is, you're much better adept to giving them the information that they'll listen to. It's kind of like in my life right now, I have two fabulous teenagers. They're both boys. And if I don't talk their language, they don't hear it. So imagine how to educate them where they're at. And where they're at means they need to be able to start focusing away from some of the stress and into some of the opportunities. And that's what you're all about on your social media platforms. And we take great pride in showcasing things like, how do you maintain a healthy weight? Some of us may have gained 5 pounds over the course, or 10 pounds of COVID, where stress got to us. And the nearest thing that we got into is, the munchy foods, the foods that make us feel good, the comfort moments. That's okay. Embrace them and let them know that the future can be different if, in fact, they put their best foot forward, getting out and doing some of these important things for them, whether it's breathing or yoga or stretching or just coming to the chiropractor. These are all really great moments for them to decrease their stress, increase their level of awareness. And while many of you have said, well, you know what, I don't do a lot of nutritional supplements in my office, it's okay. You don't have to use everything we do. We're just giving you as much as we can so that you can use what works best for you. And one of the things that we found was a major study that came out that showed how important our pets are to our well-being. So fun things that we can share. A lot of patients have said, I like to garden to decrease my stress level. Well, good on them. But you know what? Gardening can create its own stress levels on your back, on your joints, and on your ligaments. So we want to encourage getting out and gardening, snuggling your pets, and using some fun things just for the fun of it, okay? Enhancing your health with chiropractic leads to improved overall health. Maybe they'll sleep better because they're not in pain. Maybe their stress levels will come down because you talk to them one-on-one about their stress levels. Maybe, in fact, their sense of control over their own health will rise up because, let's face it, you turn on the news and you're getting a lot of negative. So we want to give them the positive through Foundation for Chiropractic Progress's infographics, ebooks, opportunities for you to give a PowerPoint presentation, and just be you, because they're coming to you as the expert. And speaking of experts, how are they going to enhance their health? Make them aware. The filthiest public surfaces, gas pump handles, ew, ATM buttons, yuck, public door handles. We kind of all knew those. But what about the mailbox? How about the escalator? All these things we want our patients to kind of just think twice about as they touch them. Wash your hands. Be a part of the solution. And speaking of solutions, we want you to be aware of our brochures. A lot of new things happen through old ways. So for example, paper products are the new emails. If your email is chocked full, what if you as a chiropractor did something that you haven't done in a long time? You actually sent them a brochure with a thank you for their patronage and letting them know that you're thinking about them. A paper outreach could mean something to them. Optimizing their health. You fold that little brochure piece of paper that's on the right-hand side of your screen and you send it to them. Just thinking about you, Mary, and wanted you to know that I'm here to optimize your healthy living. Outreach means everything because they're sitting behind their desks. Some of them are in these worst work environments they've ever had, the home environment. And we're trying to get them to be aware that where their monitor is and how far away from it is from their eyesight could impact them. COVID-19 means transition to new environments. It means setting up ergonomically correct workstations, and it means you, doctor, you in practice have to bring it up, whether it's through an infographic, whether it's through a brochure, or you're putting it on your website. Hey, I've got a 5-minute presentation for you today, patients, on how to set up your proper work environment, because many of you are still stuck at home, and we want you to be able to have a proactive ergonomic setup. That's how you do it. I would say working from home and having these opportunities to talk about the self-help opportunities, like 7 healthy tips to manage working from home. It's an amazing moment, and you as a chiropractor are going to feel that. Now, one of the key criteria here is we have set up new channels for videos. And you can see at the bottom, we have a YouTube video here that talks about chiropractic and posture. And that's a really next step for you. Put them on your Facebook channels. 90% of people actually pay attention to videos. They may not pay attention to the infographic or the words around it, but trust me, videos do capture their observations. And a lot of times, and it's been noted, almost 95% retain the information when it's through a video. You can see through these particular areas that opportunities arise where you can start talking about webinars and telehealth webinars and what that means to your practice. This is the new ebook that really stimulated this entire presentation today. It is the Enhance Your Health Through Chiropractic Care. It's a fabulous opportunity for you to have it on your website. And the link below and all of this information, Christy will have available to you so you can start to click through and understand where the patient is and where you, as the doctor of chiropractic, can enhance their health through chiropractic care. Figure out what works for you. You may even want to spend a whole day teaching every patient about belly breathing, or teaching them about prana and what it means, or teaching them about postural changes that they can make at home. You decide what's right for your practice and then implement it. A lot of the related COVID opportunities come through just being able to be aware of what the CDC is saying and how your practice is being impacted through that. A lot of position statements are being released by state associations. I'd like to say this: 37 state associations across the United States have joined with the foundation to make and implement national marketing that has quality service involved. And your state association is so incredibly important when it comes to position statements, such as what's needed when essential care is provided and what non-essential care means. So creating those opportunities and learning from those around you and having access to COVID-related information is of utmost importance. Now listen, many of you on this call have no idea if you're a member or not. Well, let's start with the basics. If you are part of your state association and they support the foundation, you have the beginner access pass. That's called group membership. And that's going to lead you to, when you click on f4cp.org/package, you'll see what group membership is. I've never seen progress in the last 3 months like I've seen now. We've had 100 people in the last few months join as gold members. And that means at $100 a month, they're getting packages that they can start to work with their office manager. They can start working with their front desk and start to create packages where they're using the infographics, and it's all done for you. You get to design, create, and really build out what is right as experts in your area and how that will impact your consumer healthcare awareness. So I encourage you to explore the Foundation for Chiropractic Progress. Ensure that you're creating an environment that your patients understand that you're a key resource. And together, as national recognition and marketing is happening, and you at the grassroots level in your community, we're going to create an environment of essential health using chiropractic care and all the benefits that are around for you and with you. I want to thank ChiroHealthUSA for the opportunity. And Christy, I'm going to turn it back over to you.
Thank you so much, Sherry. To remind everybody, I think I posted it in the chat box with all of the links that were mentioned in the PowerPoint presentation. But if you are a ChiroHealthUSA participating provider, you do have access to the group membership benefits for the Foundation for Chiropractic Progress, which we try to remind people about on a regular basis. So if you've not utilized those benefits, you are participating with ChiroHealthUSA, just email us at info@chirohealthusa.com. We will send you the one-page handout from the foundation that tells you how to access those benefits. But again, I would definitely utilize that f4cp.org package just to see, because depending on your tier in the foundation, it does give you access to a lot more information, but it's so phenomenal. Everything that they do, and follow them on Facebook. If you are just like running out of stuff, like you're kind of at a loss of what you need to be posting, or you're just looking for something fresh, they post all the time. And everything that they do is beautiful, timely, and just phenomenal and amazing. So, they have everything from social media to press releases to videos to posters and everything you could possibly think of to help in communicating with your patients in your community. So I love them a lot, if y'all can't tell.
And we can't thank you enough, and we love you back. That's one of the benefits of working with solid corporate sponsors like ChiroHealthUSA, is that they help us reach the national market. And Christy, we cannot thank your corporation for being so up to date and constant in your vigilance to really promoting quality information out into the consumer marketplace.
Well, it is our pleasure to help, and bless it. Sometimes when, I just interject all up in the middle of stuff all the time. So thank y'all for letting me help in a very small part. So I definitely encourage y'all, please visit their website and see all of the amazing things that they put out. And when I say like on an unreal scale of how much information comes out from the foundation, it will blow your mind, because what Sherry talked about is such a small part, but it's such timely information, because right now the conversation that we do need to be having with our communities is about improving their overall health. And like I said, you saw all the examples that she used. They're beautiful. And it's not anything that anybody can argue with. We all know that we need to drink more water. I'm working on my gallon.
Atta girl.
So, and I carry that bad boy with me everywhere I go. So we know we need to be drinking more water. We know we need to be getting more sleep. And so it's a great way for you to segue into those conversations. So if y'all have questions for Dr. McAllister, please submit those now. Now I will tell you, because y'all know this is going to live forever on the website in the archives. If you're watching this webinar recording and you're like, man, I can't believe I missed this amazing presentation live, and I have this great question for Dr. McAllister, she has provided her email right here, or you can also submit it through the chat box. It sends it automatically as an email, your question and contact information, to the team at the Foundation for Chiropractic Progress, so that they can reply back to your email and answer your question that you submitted during the recording, because we want to make it super, super, super easy for all of you to be able to communicate and engage with them. I'm going to be super disappointed if I don't see that all of y'all did not follow them on Facebook if you're not already doing so, because you're only hurting yourself. I'm trying to think, is there anything else that you can think of that you want to talk about, Dr. McAllister?
Well, Chris, you did say something that was very apropos, is hurting yourself. Is when you're not in it to win it, you're on your own game plan, and usually you fail. And so as a group, what a collective impact means is that we're all on the journey together, hand in hand, elbow to elbow, really making a difference. And something simple such as just linking in with me on LinkedIn or Instagram or Facebook or Twitter really helps you to be on the cutting edge, because when a research article drops, such as what happens in Clinical Compass, if you don't know who they are, I encourage you to look them up. These articles are important because if it's something that's valuable to your patient, you want to be the first person to say, like when the Lancet study dropped on Good Morning America, so many of you were flat-footed because you didn't have an alarm clock going off the day before saying, everybody be prepared. There's going to be a fantastic opportunity for you to talk to your patients. It'll go, come on, Good Morning America. It's a Lancet study. It's epic, it's historic, and it's showcasing that a non-pharmacological option is available called spinal manipulative therapy. Please talk to your patients about what SMT is about and how it's called an adjustment. Those are the kind of things that the alerts, the bells, the whistles, all of us together are going to make a major impact. So thank you for bringing that up, Chrissy. I think it's a critical component to staying live, staying active, being vibrant in your community.
And again, if you are getting like your newsletters and updates for the foundation, make sure you're looking at them, because anything that is breaking news that is going on within this profession, they know first. And they tell you so that you can be prepared. Then they also make recommendations like, this is what's coming out. Here is a press release. Here's a post for social media. Alexis with the foundation comes up with like a marketing plan for marketing your practice, utilizing the resources at the foundation. That's in an email that you get every month. So if you don't have time, do like I do. I have them go into a folder, and I have time on my calendar every week to go in there. Actually, it's twice a week. I go in there twice a week and I read all of my updates from the foundation so that I know what's going on and what we need to be doing to help support our 5,000 plus practices, and to help for our own practices that we own here in Mississippi, letting, our doctors and our marketing team know, hey guys, did y'all read this? Did y'all read this latest update? So I'm going to do my screen share real quick, because y'all know this is my favorite time where I talk to y'all about all of the wonderful webinars that are coming up in the webinar series. But before I do that, the foundation also has a webinar series. They have some that are directed for like the team and the doctor. And then they have this whole other series that is directed for CAs. And you'll recognize some of these amazing people because I love them and they're on our webinar series. We just had Wendy here last week. So, and these are phenomenal. They're great. And I'm not saying that because they asked me to speak on there last year, but they're great. They're so wonderful. And every now and then they're like, well, who do you think should talk about this? Let me give you my 20 favorite speakers of all time and why I think y'all should put them on there. So again, this is all on their website. There's so much good stuff. Okay. So as far as our webinars go, here's what's going on. We're going to be talking about accounts receivable next month. Not the sexiest topic in the entire world, but you know what? A very healthy accounts receivable is what keeps us in business so that we can continue to serve our community. So you should definitely be on there, because I love Dr. Unruh. He breaks it down on how to put systems in place, make sure you're staying on top of that. So it's fantastic. Now, unfortunately, I thought we were going to be ditching COVID for good here in the fall. Does not appear to be the case, obviously. So we are going to be talking about what are some updates going on around the country in the profession from OSHA, which most of us didn't even know applied to our chiropractic offices, but it does. And so we're going to be talking about the updates that have been coming out around the country, what we need to know. And then we're going to be talking about how it's affecting healthcare practices all around the country. More specifically, how is it impacting chiropractic offices all around the country? And let me just tell y'all, Jay Greenstein and Brad Koss have some amazing data that they're going to share with you, and then how we can use that data to help benefit this profession. And you may have heard the rumor, we have a new ABN form that is out, and it is going to be required for use actually, like, I think it's August the 28th. So like a couple of days after Dr. Evan William, my brother from another mother, who is going to be here to talk us through the new ABN form. And I have another webinar that is not posted yet that we should be announcing next week. And it is going to be the best panel discussion / party ever to take place, even if it is somewhat about COVID. So make sure you go online and register for those now. So I do have a question that came on. So Dr. Anderson, she was a little late coming in, but she said, if you had to say, Sherry, what were the 3 most important take-home messages that you covered today, what were they?
Excellent question. And I want to preface it with, this is going to be based on your practice and how much you love to teach your patients. But right now, the most important thing is we have to recognize that the patients are stressed out. When they come in, they've been put in extraordinary circumstances, from their job to their healthcare to their family life. So appreciate stress management for where they are and how you can help them. When you start looking at stress management, you cannot avoid sleep, and the problems that come with a difficult REM cycle and why sleep is so important. When you get to the sleep, that's number 2. Number 3 is mindset. How you passionately provide the love and care about the patient's progress is the key. So those top 3, stress, sleep, and your own mindset and passion for what you do are the key winners in how to energize your front office and your back office during these difficult times, reminding them that they can't run a practice without them, and that they're part of an amazing system that works together hand in hand to ensure the safety and the health and well-being of our patients.
I love everything that you just said.
Thank you, Christy. You're the best.
See, I tell you, I just like speak whatever's on my mind and just like spit it out with like no rhyme or reason. But I do. I love all of everything that you just said. And I imagine we all know how stressed out we are. And everybody is a little bit stressed out, strung out, and put out with the COVID. Especially right now, I'm sure that the talk in all of your communities is the same as it has been in mine for the last week, which is, what are we doing about going back to school? And apparently every option offered is not necessarily the option that people were looking for. So helping everybody to address that stress is such a big thing, because that stress is what's affecting their sleep. And then it's just this really vicious cycle.
Well said, Christy. It is a vicious cycle, and we are the well-armored profession to break through that cycle. And that's why I think we need to position ourselves so effectively as a well-being expert and create those environments to which they feel comfortable coming in and talking to us about it.
I agree. Well, so we're going to wrap this up, because I could keep y'all here all day long. And mostly because I just miss talking to Sherry. I don't get to see her all the time.
I'm sorry I don't get to see you, Christy, and I apologize to your audience. But you know what? Stress management came on right before this call, and for the love of God, I could not figure out this technology and why it wouldn't work on webcam. But please know that I'm with your audience. I adore ChiroHealthUSA participants and them being part of our group membership package. So please utilize us effectively. We're right there with you.
Well, I hope you all have an amazing rest of your day and a fabulous week, because you deserve it. And y'all have a restful and relaxing weekend, so that next week we are ready to again talk about not necessarily the sexiest topic of accounts receivable, but we're going to learn some very interesting things from Nathan Underwood. And on top of that, he's super funny. So we are most definitely going to have a good time. So make sure you go to the website, register for that webinar, and I will see y'all next time or next week. Same time, same place. Bye.